Well, it's probably been a couple weeks since I've done one of these videos. Haven't really, I don't know, once I kind of adapted to the chemo, didn't really want to talk about it, but here's a few things to talk about. So, went in for it is Friday. Don't even know how many days in it is at this point. It's kind of a moot point. But I went in for my 6th treatment, which would have put me at halfway, and my platelets were so low that they decided to go ahead and delay my treatment again. So they delayed it again, but the problem being they wanted to move it a week, and that would have put me where I was getting a colonoscopy while I had my pump on. And if my platelets are low, that means that I could bleed out real easy. And so if during the course of my colonoscopy they found something that they needed to remove, then I wouldn't be able to have that done. And so now we've delayed my chemo another week. So that'll put me 2 weeks back from when I was supposed to get my 6th treatment till I get my 6th treatment. Had this weird thing where I've been hurting my fingers lately. This finger, no, I'm not flipping you off, but I actually was pulling a hood latch on my Jeep, and I felt something pop, and it got to the point where I wasn't able to close my finger all the way. And then last night, it happened to my other finger. I was just simply lifting up on my desk, and I felt it sprain almost. They think I haven't been able to get an MRI, but did get an X-ray. They said it's not broken or anything, but it's just telling me that my body is getting increasingly fragile compared to what it used to be, and that's interesting. I was considering maybe getting back to working out a little bit because I really do enjoy doing that. It helps relieve stress, but I have been unable to do that because now I am really worried about hurting myself, and so I'm kind of have to resign myself that I'm not going to be able to do that. I do have like a pounding in my chest a lot. Get lightheaded a little bit, have constant metallic taste in my mouth, have some loss of feeling in my fingers, kind of feels like tingling. My feet haven't really had that problem too bad yet. My feet are swollen. I can tell that my shoes aren't fitting the same way they used to. I put on a little bit of weight actually, just because I'm eating a lot of junk food, to be honest. Other than that, I mean, I've actually, not getting a treatment is again a positive thing. So I was going to go hunting and wasn't going to be able to go due to the chemo, and now I will be able to go. Obviously, I'm not going to be going as hard at it as I normally do. Mostly just going to kind of get away from things and take it easy. Probably just ride around the truck most of the time. Other than that, not a whole lot really going on. Just working, doing my best to stay positive. Do go through some down days where it's hard. When I'm feeling better, it's way easier. I really feel better, and it feels really good to feel good. But it's funny, a friend of mine, he hadn't seen me since I was in the hospital. And I saw him yesterday, and he told me today, he was like, "Man, dude, you really don't look good. Looks like that chemo's beating you up." I was like, wow, well, didn't realize it had been that long. But anyways, that's kind of where I'm at. Just really looking forward to being done. Looking forward to living my life, being able to do the things that I enjoy doing without having to worry about hurting myself, and getting some mental clarity back, getting my focus back, these kinds of things that are important to me. Getting a sex drive back, that's something else that has happened, is that my sex drive has been relatively non-existent compared to pre-cancer, which obviously is irritating my wife. But that's kind of about it, really, I guess. Anyway, I'm yelling because of nervousness for some reason. Not normal, but it's been nice to not have the hiccups. Anyways, I guess this just delays my treatment another 2 weeks, so we'll see. At this point, I seriously doubt that I'm going to make it the full 12 cycles, just based on how my body is responding to things. The oncologist is already talking about he's going to have to lower the dose just based on the way that my body's been responding to everything. But it is what it is, so hope you all have a good night, or day, or whatever it is.